Nathan, if you could just tell me a bit about your trip to Ecuador.
I'll start by saying who I am. My name's Nathan Betteridge. I'm a doctor currently training to be an anaesthetist. Um, as part of my year last year, I was teaching anatomy at one of the universities in the northwest, and I also got the opportunity to go on a field trip to the rainforest with the university. My role within that was to be the field course medic. What that meant was that I was in charge of and assisting with the medical care of all the all the staff, and also the students. The reason that I was asked to go on this trip is because where we were in the middle of the Ecuadorian rainforest, which is just comes off one of the tributaries of the Amazon. It's extremely remote, and as part of that, you need to take a boat down to the local town in order to get to near where the hospital would be. And if the river's particularly high, then what should only take maybe 2-3 hours to get to a hospital may take 24 or 48 hours. So the potential there is that you have to keep a patient or whoever you're looking after, you need to keep them stable for that particular length of time with very, very little equipment, and pretty much what you've got in your first aid kit and your medical kit. So a challenging place to work, because it's not the most hygienic of places. I was actually surprised at the amount of mud that you came across there. It's just got everywhere, and the other thing was the moisture. So we took a medical kit with all our stuff in it, but by the sort of time we'd arrived, all the paper bits that would kind of packaging bits that would keep everything nice and sterile had pretty much gone moist and wet. So you're working with sort of not the most clean equipment already, and you've got also the added difficulties of weird and wonderful medical conditions that you don't see in the UK at all. Really, you've got the big one is malaria. It's obviously carried by mosquitoes, and they're rife within the Amazon. So you're always watching out for people with high temperatures or anything that could happen there. We did have one staff member who had high temperatures for about 3 or 4 days, about a week after they'd arrived. So malaria is always something you got to be worried about. We did have a malaria testing kit, which we could use, which thankfully for her was negative. Um, the other sort of things to think about is a disease called cutaneous leishmaniasis. That's very rare, and I've never seen it actually. In all my studying, I never actually saw it. I just saw pictures of it. So going out to the rainforest, you're always slightly worried that you'll come across something that you've only ever seen in a textbook. And as soon as we arrived, actually, we had one of the staff members who'd been at the research station for some time. She had a weird sort of skin lesion, sort of weird bumps and redness on her skin. And you're kind of thinking, what on earth is this? What on earth could it be? She'd had it for about 10 days. It wasn't painful. And that's always worrying when something like that's not painful, because it usually means it's something a bit nasty, really. And cutaneous leishmaniasis is something that you get from sandflies. So again, you see more sandfly than you do mosquitoes in the rainforest there. So looked at her and sort of kind of had to go through all the different things I could potentially think of that could be causing the problem. Cutaneous leishmaniasis was one of them. And the thing is, if it was that, she may have needed some chemotherapy, which is the treatment for it, which is pretty nasty stuff. So as it turns out, you kind of start from the simple things and work your way up. So we treated her as a sort of fungal infection just to make sure it wasn't something sort of very basic. And actually, her skin lesion improved quite a lot with the sort of fungal medication. So it probably was just a weird sort of fungal infection that I'd not seen before. So that was another thing that you kind of get. The other challenges are you don't know what sort of bugs and animals that you're going to come across. I mean, the biggest thing is probably students getting drunk and doing weird things and tripping over and going over on ankles and breaking bones and things like that. Thankfully, we didn't have anything like that, or allergic reactions. That's always another big thing that you'd worried about. Certainly if they get stung by weird bugs or things. Uh, the other thing is plants. If you kind of brush up against plants, then you don't know what you might potentially come across. There's over 1,000 different types of plants in the rainforest. I mean, one of the professors there was talking about the trees out there. In a square block, let's say 10 meters squared in the UK, you'll get maybe 2 different species. Within the rainforest, you'll get at least 20 plus different species in a very small space. So there are plants out there that still haven't been discovered, still haven't been found. So you don't know what sort of reaction people will have to those, certainly if they've never come across them before. So you always worry about whether or not you're going to get some severe anaphylactic reaction or something. So you have to just be aware. And bugs as well, a lot of them are harmless, but where we were, you had one of the most poisonous spiders in the world. The Brazilian wandering spider was about there. So you're always worried that you might get that. The other thing as well is a bullet ant. That's a big sort of worry, because not so much that it's poisonous, but it's just extremely painful. It's described as a bullet ant for a reason, because it feels like you've been shot when you get bitten by it. It's about 3 centimeters long. It's pretty big. It's much bigger than any ant you'll see in this country, and it's actually in a lot of tribes in the Amazon, it's kind of a passage to manhood. So what you'll get is that a young boy will put their hand into a bag filled with bullet ants, and they'll get bitten by them, and they will then have about 48 hours of ridiculous amounts of pain. And if they come out the other side of it with no problems, then they will be entitled to a wife and a house. So I kind of weighing up the risk benefits of either taking a mortgage here in the UK or getting bitten by some bullet ants in the Amazon rainforest. I think I'd probably take the mortgage. But yeah, I mean, these are the things you sort of worry about. If a student had got bitten by one of those, then you just have to give them painkillers and hold their hand through it, really. There's nothing else you can do. So probably one of the worst things we saw. Thankfully, we were fairly blessed with good health for most of it. We did have one staff member who got bitten, probably by fleas, we were thinking it was, that got infected while she was in the rainforest. And her ankles got massively swollen, both sides. Basically to the point where her calves and her ankles and feet all kind of merged into one, and you couldn't really sort of tell the difference between them. And we treated her with some antibiotics, pretty strong antibiotics, for a couple of days, and they weren't improving. So the decision had to be made then of, do we keep her in the rainforest, or do we sort of move her on? What was that too?
Yep, ready.
Yeah. So we had to decide whether or not we were going to keep her in the rainforest, where she's at risk of kind of getting more bites, the infection's getting worse. The other thing as well is we had to worry about whether or not she could potentially develop what we call septicemia, which is where the infection in her tissue, her soft tissue, and her ankles would actually get into her blood. And once that sort of spreads around your blood, you can get very, very sick and actually potentially die. So because things weren't improving, and because of where we were, we felt you've got to kind of play these things safe. If she'd come into A&E in the UK, I would have admitted her into hospital with the situation she was in. So I took it on that we would send her into town, into the hospital, to get seen. So she did go there. She went on a course of steroids as well, and actually sort of got much better actually out of the outside of the rainforest. So that was a good outcome, obviously. So it was an interesting and challenging experience, because the thing is, as I've already said, you've got to constantly be on your guard, or just aware that things may happen at any time. unlike sort of when you're in hospital, where you're surrounded by your equipment, you're surrounded by the nursing staff, you're surrounded by other supportive staff and doctors. You in the rainforest, you're on your own. There's there's no one else to kind of call on, and the kind of buck stops with you. So you could one moment be kind of relaxing in a hammock, which I did get the opportunity to do, but within minutes you could then have to be dealing with someone who dislocated their shoulder, or any of those sort of potential emergencies. So you've got to just be aware and on your guard, more so than when you're in hospital, where you can then go home at the end of the day and it's done. So that was a challenge, but quite exciting as well. I do enjoy that sort of environment, and I have had the opportunity of being a medic abroad in Africa as well. So I was able to draw on a lot of that experience too, which was good. I think there is a big challenge with the healthcare over in Ecuador. The local town, well, I say town, it was more of a very small village that has a health clinic there, has a doctor maybe once every 3 weeks, and often the doctor will go once and never show then for the next 6 months. So you've got actually people coming to you from the local community as well, or they were coming to see us and see myself at the research station. One particular girl, I remember, she had a big lump on the top of her head, on her scalp, and it looked like potentially like a botfly had put one of its larvae in a scalp. So how that works is that the botfly are about the size of a bumblebee. If they were to come to you, you'd probably swat them away pretty quickly. So how they get around that is they lay their larvae on other flies, and these flies can just come along and just land on you. And then when the larvae that are on the fly feel sort of your heat and register your carbon dioxide, what they do is they fall off into your skin, and they burrow down, and the larvae just grows within your skin, within the top layer of the skin. So this was what I was thinking with this little girl, that it had kind of been on the top of her head. So the treatment for that is basically either you can just let nature take its course, and the fly will eventually grow up and then just fly out, or what you can do is you can get some Vaseline and just spread it over the top of the head, and spread it over the air hole that it keeps to the top of the skin so that it can breathe. And by doing that, what it does is it causes the larvae to come to the surface. And then it's just basically a case of grabbing some tweezers and just trying to catch it before it burrows down into the skin. So unfortunately, I didn't get the opportunity to do that because the girl didn't come back. She was only about 5 or 6 years old. And this was the other thing, is the follow-up in those sort of environments are really tricky, because a lot of parents will take their kids to shaman, local sort of witch doctors first, and they won't come and see the sort of Western medicine doctors, because their experience is that they never show up and they're not there half the time. So it's not great, really, and often you'll get people who are very sick not getting the treatment that they need. I do remember once, actually, we went to go and buy some meat from a local guy who lived in the village. And this meat is pretty much just like a large rat, basically. I think it's called Pacow, I think it was. And when we got there, we went to their house, and these houses are kind of high up and on stilts. And I do remember the really bouncy floors that they had. But they asked us to see this guy's little girl, because she was in bed and she'd been unwell with a fever for about 3 or 4 days. And in reality, it was just a bad flu. But the thing was, four other children in that community had actually died in the last sort of month or so from similar sort of symptoms. Whether it was a flu that they didn't control the temperature with, or it was something else difficult to say. It could have been malaria, but it's just that thing of there's a need there. There's a need for medical attention, but um, you know, they have so very little there, and people won't sort of go there. And they don't have things like paracetamol and other things like that. Just simple medications which would make a massive difference. So yeah, a lot of challenges for there. And I guess the thing that I sort of took from it was, a lot of memories, a lot of great experiences, but also it's humbling to know that when you come home and when you come back to this country, you've got a medical system that is there when you need it and is free at the point of care. I can go into A&E at any time with any problem and be seen, or I can see my GP and get very simple sort of medications and treatments that can be life-saving, whereas these people out in the rainforest have nothing really. So it's a challenge, and one which is a big hurdle for the Ecuadorian government to overcome, but hopefully I'll get the opportunity to go out there again sometime, and maybe go on another field course with the university. But certainly, I would like to take the opportunity to go and do more sort of medicine abroad, and go and take part in those things.